So my name's Dr. John Howarth. I'm a general practitioner by background. I'm one of the directors in the Partnership Trust leading on service improvement. I'm Interim Deputy Chief Executive, and I'm also the clinical lead for CLIC, the Cumbria Learning and Improvement Collaborative. I'd like to tell you about what I think should be our main ambition in the way we design services and deliver care across Cumbria. And what I'd like to talk to you about today is the population health equation. Now, the population health equation is when fully integrated health and care providers, so that's the acute trusts, the primary care, general practice, community providers, mental health, social care, meet a population, a whole community is mobilised at scale for health and well-being. And if you put those two things together, you have a population health and well-being system. To illustrate this, I'd like to tell you the story of Millom. Now, in May 2014, people were marching on the streets in Millom to protest about the stripping out of services from the town, the fact that health providers hadn't been listening to the population and the community and what their wishes for healthcare were. Now, over the last year we've made fantastic progress by getting on side with the community, with the Millom Action Group, League of Friends, the patient participation groups, and working together on this equation, so bringing all health providers together, supporting general practice, but working with a community mobilised at scale for health and well-being. One of the things that the community have done, they've helped us recruit to general practice. The practices spent well over 12 months advertising for a GP, and they didn't have one response to the advert. There's a number of initiatives, but one of the initiatives to help recruit was a video that I'm going to show you now that the community developed and spread through social media, tweeting and on Facebook. In the first week of producing this video, there were 5,000 views on YouTube. Now, we now have 4 doctors recruited to the town. We've still got some vacancy to fill, so we're not quite there yet.
We think the doctors are great,
but we need some more!
I offered to help, but they said,
come back in a few years' time!
But no one said I couldn't get some practice. Now, who's first? Aww.
Other things the community have done, working on that side of the equation. So if you remember the equation of fully integrated health and care providers meeting community mobilised at scale, the community have developed demand initiatives, teaching the community how to use the health services. And the 2 things I'm going to show you. One is the newspaper they've created for the town, full of health promotion messages, including how to use your health services properly. And we will be rolling out how to spot cancer early and other initiatives to build the sort of health literacy and self-activation, self-management within the community. Another example is that the community have led an initiative with the schools, working with all the health providers to teach the school children how to use the health services properly. And there was a health week in the schools in Millom, culminating in a big theatre production in the town. The theatre production was called CLIC. It's very funny. 600 to 700 children went through this theatre production. They had a big sick, little sick game show, teaching people how to use the health services properly. And in one of the schools, when they were putting on this production in front of the parents and teachers, they asked a question to the children assembled: how long does an ear infection last? And every hand went up, and the answer 2 to 3 days, correct. Next question, does an ear infection need an antibiotic? Again, every hand went up, the answer is no. So modern treatment of ear infections is without antibiotics. So all the children in the town knew that, and they were teaching that to their parents. So to summarise, what I've described is a population health system in which fully integrated health and care providers meet a population mobilised at scale for health and well-being.